Oh, and welcome. This is writing the accreditation report. This is the initial accreditation report, our 5-year accreditation pathway. So I am very happy to have all of you with me here today. And just so that we move forward here with this, I'm Linda McKee. I am the Chief Operations Officer for AAQEP. I'm also joined by Sara Hiller, who will be speaking later on. Sara, wave to everyone or say hi, whichever way you'd like to do it. And Sara is the Director of Accreditation Services. Now, not on this slide, but joining us today also is Dr. Karen Lowenstein, and Karen is our Director of Member Services. So if you've been working with AAQEP in any capacity at all, you've probably met either Sara or Karen at some point, or you will soon meet them again. So welcome to all of you. Our agenda today is we're going to look at, first of all, an overview of the 5-year accreditation pathway. We call this a 5-year because we also have a 7-year, but this one's just a little bit different, though there are some similarities. Then I'm going to talk about what the report looks like, the outline of it specifically, and then Sara's going to come along and help us a little bit with some of the information that's specific also to the IAR. So these are the 4 standards that we have presently. The 2018 standards is what I'm calling them, because soon we're going to roll out 2025 standards. But these are the 2018 standards that we have in process right at this moment. You can look at them across the board. Foundational expectations would be standards 1 and 3, pretty straightforward. Standard 1, candidate completer performance. Standard 3, the quality program practices. But we also have the contextual challenges in here. So these would be standards 2 and 4. Standard 2, completer professional competence and growth. Standard 4, program engagement and system improvement. So with the IAR, it's set up a little bit so that under the completer performance column, these are the ones where you'll really be putting more information specific to aspects. The program practice column, the aspects are a little bit integrated throughout different components. So I've tried my best to see if we can help you to understand exactly how they're all addressed throughout in different parts. So let's move forward with those as we talk about this a little bit. So the initial accreditation pathway, this is the 5-year pathway. It's a status that's awarded with that review of evidence of the program capacity and effectiveness. That's accreditation. We have to do that all the time. And it does show that you meet the fundamental quality requirements. It is available for newly launched programs as you're starting your operation and building your data sets, but it also supports that timely transition. Either you have no accreditation at the moment and you're coming onto AAQEP's new, or you are with another accreditor and you're transitioning into AAQEP for your accreditation. And this is to help you to align this to the new set of standards. It is non-renewable. It's a 5-year term. Sometimes the states have a little bit of different timelines. And if so, you just contact me or Sara or Karen, and we'll help you to understand that. But in this case, for AAQEP, it is always a 5-year timeline. So how's the 5-year similar to the 7-year accreditation? Well, it does have a self-study report. And this, of course, is called the IAR, or the Initial Accreditation Report. There will be a review team with a local practitioner that you select, and that team will conduct a virtual pre-visit review. They'll get together, talk about what is in your report, and have that information available for you in a report themselves then coming to you. They'll also have that provider conversation with you. So then the team will conduct a virtual site visit that includes the interviews with a variety of stakeholders. Same way that we do with the 7-year accreditation. And the reviewers always only affirm, verify, and gather corroborating evidence. They do not make judgments or any decisions in any way. So continuing how it's similar is that the review team will complete a final team report. That team report then will come to you for factual corrections. You'll send it back. It'll go to the commissioners. Commissioners then review your IAR, your report, and the team's report to make a holistic decision about each standard. And then, of course, annual reports are always required. Now, because the team is the commissioners are making a holistic decision about each standard, you still have to respond to the different aspects. And so I'm hoping that this will help you a little bit to give you some idea about possible ways to respond to some of those aspects. How is it different? So with the 5-year, the site visit is conducted virtually. There's not an on-site visit. It's completely virtual. There's little or no outcome data in the report. So we'll talk about that as we go through these different sections, all right, about exactly where we're talking about with this data. So you're not really looking at analysis, you're looking at planning for the data and analysis. The questioning guidance for the stakeholder interviews they're a little more explicit. They're digging in a little bit more to the aspects because you may not have presented them in as much depth as you would with the 7-year. The 5-year IARs are shorter than the 7-year QARs. The QAR is the Quality Assurance Report. So this initial accreditation report for 5 years is just a little bit shorter usually because it doesn't include that outcome data, right? And the team report is framed holistically at the standard rather than the aspect level, which it is with the 7-year, but it's also by the different components because the IAR, it is broken into different components more so than specifically following the guide of the different standards. And so sometimes the standards and the aspects are integrated throughout those components. So your 5-year initial accreditation report, it yields an accreditation decision. It provides the measures that are used to provide that evidence. What is it that you are going to use? What are the instruments and the measures you will be using, or the documentation that you will be using to provide evidence of the completer and program effectiveness? It also talks about how you're engaged with P12 partners. This is a mutually beneficial partnership. So both how are they assisting you, sometimes with the clinical placements, but then how are you also assisting the P12 partners? Sometimes it could be with other courses or some supports that might be taken to the schools or the districts themselves. Talks about your program's capacity. This is like, do you have the capacity in order to really sustain this work and do what you're talking about and what, about the program? And then it also calls attention to your data quality. So all these pieces we're going to talk about, they're integrated throughout the outline of the report itself. So having said that, that's a big overview of the initial accreditation pathway, that 5-year pathway. But I'm going to break it down into the outline of it and go through that step by step with some ideas about how you could address them. So here we go, writing that report. This is the 5-year initial accreditation report, the IAR. It has 7 different sections to it. And I'm going to break these sections down and go through each one of them individually with some ideas. So as you can see, section 1, pretty basic overview. Sections 2 and 3 are standards 1 and 2. 4 is the partnerships. 5, the challenges and even some innovations. 6, your program capacity. And 7, your evidence of data quality. So let's move through those one at a time. So section 1, the introduction and overview of your program and the study itself. So this is where you'll be putting a brief history about your institution, a little bit about your program and the programs that you have seeking accreditation, an explanation of the mission of both your program and the institution and the rationale that shapes that. This is where you could also put an overview of the candidates and the faculty demographics. Now, this is not going into the full faculty demographics in depth. You'll put that into section 6, all right? But this is a brief overview, just having giving us an idea of what's going on. I'll say one thing too. This is a great place to put section aspects 4E and 4F, and I'll talk about that later on. All right, so that's a little bit more information about you're really thinking about what it is that you're doing with the state also. This includes the program specification table, and as you can see, there is the website where you can download a Word document for the program specification table. This table is one of the 2 absolutely required tables. This is one that you must complete. You are going to be telling us and the reviewers who you are putting forward for the accreditation. Which programs are you putting forward? And the number of candidates, the number of completers in there. This is the one that is extremely important. We have this. You'll be presenting the measures and eventually the evidence that would be for these particular programs. So we'll think about that. It's a really important table. And again, as I said, you can find that on our website at aaaqep.org/IAP. Section 2 is about those measures for standard 1. So that gets a little confusing sometimes. Section 2 is for standard 1, right? Here are the 6 aspects at this moment that we have for standard 1. So you'll look at all 6 of these and hopefully address each one of those, okay, specifically for the measures that you're putting forward for this, including the criteria of success that you'll be talking about. So in this section, you're going to be giving us the ideas about the evidence sources or measures that you intend to use to support the aspects, all 6 aspects of standard 1. So it's really pretty straightforward. Those 6 aspects, what are the measures, what are the evidence sources that you'll be using? You will also use the aspect evidence table for standard 1 and standard 2. All right, and I'll show you that table in just a moment. It's also available on our website. You will address each aspect explicitly, and you will link or append the measures as applicable. So especially if you have locally developed measures, you want to make certain that you give us some blank documents there for that. The key to this particular section is a plan for the data analysis of standard 1 measures. So again, remember, little or no outcome data, but you do present the plan for the data and analysis. So that would be in that particular section for standard 1. Here's an example of the aspect evidence table. And as I mentioned a few minutes ago, that again, this is on our website, AAQEP.org/IAP. The aspect evidence table is one of the 2 required tables. There was first the program specification table is required, that I showed you earlier. The aspect evidence table is required. So as we move through this, you'll see I have sample tables, but these 2 are required. They can be found on our website and you can download them. So when you look at the standard 1, the measure, the program for which the measure is used, and of course, they could be multiple programs, right? The aspect that it's addressing, the data scope itself, and that might not be as clear in there. It's really looking at the time frame. If you have that, hopefully you have a time frame in there for it. Criteria for success is what you are determining to be that criteria for success. We do not tell you what the criteria is for your measures. Even if they're nationally used measures, you are the one telling us what the criteria for success is for your program. And then the perspectives. So as you can see down below on this particular slide, at the bottom of it, that there are the different perspectives there. And you want to make certain that within that standard, those perspectives are addressed somewhere. All right, so every one of them would have to be addressed in standard 1, not for every aspect, but somewhere within the standard. And that's true for standard 2 also as we move forward into that. So section 3 is about standard 2. Now, standard 2 is the one that sometimes there's a little more qualitative research methods being used here, because it might be that you're looking at what's going on in the field. This is where you're thinking about what is happening in the program that you now can say, yes, that is happening when we put them in the field also, or when they're teaching or when they're working in the field. So thinking about that, it might be more interviews and focus groups, even some longitudinal studies, some things that you might want to take into consideration long term. So looking at this, breaking it down, here are the 6 aspects. And again, you can always find more information, and these are much more detailed. The description is available for you on our website. But these are the 6 aspects that you would be addressing within section 3. So same thing with section 3 that it was with section 2. So you'll describe the evidence source or measures that you are going to use to support each aspect of standard 2. You'll use that aspect evidence table. You'll address each aspect explicitly for every program seeking accreditation. And again, you will link or append the measures as applicable. So, thinking about what are the measures that you're going to be using, making certain that you're giving us blank copies that are going to be available for the team to review. But very, very important, a plan for data analysis for standard 2 measures. So not just where you're saying that this is what we're going to do, a plan for how you're going to do it. And we do mean a plan as in, looking at the measure itself, thinking about the time frame, who's going to be involved, all the way through, all the steps of a normal action plan. So thinking about that. And again, here's the aspect evidence table, the same one that you just saw a few minutes ago, but obviously I put it in here for standard 2. So you would have it for both of them. We only need one aspect evidence table, but it helps if you have that, both of them there together. Evidence set expectations, it would be for standard 1, we're looking at multiple measures. And I know everyone already knows about triangulation. What we do ask, with the minimum of 3, but, thinking about this, don't throw the kitchen sink in there. All right, we're always thinking, okay, that 10 does not mean that you've done a better job looking at it. We're really looking at quality, ensuring that those measures that you have an item or a component or a question or something specifically addressing that aspect. So sometimes you're going to find that those measures are being used in multiple places, because again, you're only going to use a piece of them, not the entire measure itself usually. So multiple perspectives, I talked about that a few minutes ago, really having that in that aspect evidence table, making certain that those perspectives are included. We always think about direct measures, really, especially, when you're looking at those clinical settings. But the evidence set for standard 2 will have some overlap, but they could also have a little more emphasis on what's happening in the field that completers practice when they're in their professional roles. And so that's where some of the evidence set, again, may be a little bit more along the line of some qualitative instead of quantitative. So you want to think about exactly how are you handling that, and how would you put in place the protocols for trustworthiness for that also. So section 4 is about partnerships. Now, from section 4 on, this is where it starts getting a little bit different, where it's not as cleanly outlined for the standard. So what we do is we have the standards looking at those and some of the different aspects integrated throughout some of the different sections. So I've tried to show where they could be integrated, because you still have to make certain that you are addressing the aspects in some way, but it might not be, they're not as developed with either the outcome data that we would need specifically for the 7-year. So when we're looking at section 4, we're talking about that documentation of the P12 partnerships. And particularly, we're really stressing aspect 3B and 4A, though I'll show you where you can integrate some of the others also in there, just to make certain that they're all being covered. So talking about that, looking at 3B being that quality clinical experiences, thinking, how do we really know that what is happening in the field is a quality experience for them? We all know if we have a little bit of experience with this, that sometimes we're putting them in places that maybe that's not a place that we would want to return. Sometimes we just need to make certain that we're collecting the data to ensure that it really is a quality experience for our candidates. So thinking about that in particular, that's 3B. 4A is engaging stakeholders to support schools and reduce disparities. Now, I've not ignored the other aspects on these 2 standards, okay? So just be patient with me as we walk through these a little bit, all right? But these are the 2 that are going to come up with this very first piece, engaging with stakeholders. And I have a sample table here. Now, from here on, there are going to be sample tables. We have tried to just give you an idea about how you could present this information. Instead of, going in depth with a lot of narrative, maybe you could address this in a little bit of a different way that would be more succinct and help for people to understand, all the details. So putting the sample table in, you could consider a table where you have formal partnerships, maybe informal partnerships, or even partnerships that are in the community, taking into consideration maybe your faculty has some other partnerships too. So you do a description of the partnership, when and what type it is, the value of it. How did you even determine that it was of value? Which program is, where is it, the time frame, and then of course, is it relating to either aspect 3B or 4A? So taking that into consideration, we're also looking at the other aspects that would be with standard 4 in particular at this moment. All right. So standard 4B, 4C, and 4D, there are some ways that you could integrate that also. Now, I mentioned earlier 4E and 4F can probably be, addressed in the your opening. So I would take that into consideration just to make sure that you're looking at that. But B, C, and D for standard 4, you can look at that and maybe put it in one table. And again, this is a sample. This is an idea. just trying to think about how can we organize this so that it's easy for the readers to understand, that you're not overwhelming them and you're not getting them lost in some of the information that you're presenting. So you could consider one table and just do different rows, like how are you supporting educator workforce? How are you supporting the completer career entry and growth? What is some of the available evidence on completers for program improvement? So thinking about that, because you're presenting that information with the idea of moving forward with it and collecting that evidence. So how are you doing that? And again, adapt this table as you need, or create your own table, something that's going to present that information in a succinct way. Section 5, we're talking about contextual challenges, plan changes, your conclusions. The piece that's missing in this title is innovations, though. That's a really big one because we do support innovations. We follow an improvement science model is really what we're looking at. And so with innovations, you could be presenting some ideas, some challenges that you've encountered, and perhaps from that, some changes, some improvements, or a different way of doing something. So this could be a brand new idea that you're putting forward, and you might not have the data for it. So this is a good place to start thinking about that. What would be the measures you would put in place? What would be the criteria of success that you're thinking about? Where could you go with that? Maybe you just started something. With improvement science, we're saying it could be 90 days. It could be 1 semester. It could be 2 semesters. Don't get locked down to thinking that it has to be 3 years of data or anything like that. We're really looking at making those changes, creating those improvements based on the data that you're already thinking about. So you might not have a full structure, right? Because you haven't done a full data analysis, or you may be basing it on some data analysis that you've already completed, right? So think about that and how can you do that from this. And again, I have a sample table for you. All right. So sample table, take it as you need it. But it really is helping us to understand that you're thinking about this, you're presenting this information, the contextual challenge, you've identified that. And there could be multiple ones, could be multiple changes and improvements. There's a rationale for the change or improvement. How did you get to that point of making that decision? A time frame for completion. And this could even be a time frame that's pretty broad. We're not looking at it, that it has to be completed by the time you're looking at, submitting your 7-year report. This is really, thinking about where are you going with it over a period of time. But it could also be where the different times throughout, what are the segments that you're looking at for collecting and analyzing the data to determine, do you keep it? In improvement science, we always say adapt, adopt, or abandon. All right. And so there are times when something's not working, stop doing it. So, and then of course you want to prioritize those, because if you have a list of them, think about which are the ones which one do you really need to bring forward as soon as possible. So section 6 is looking at program capacity and institutional commitment. Sections 6 and 7, both are ones that at this time reflect the appendices that are in our 2018 standards, okay? And working with the 2018 report, or the reports from the 2018 standards, excuse me. So it's really looking at what would be the 7-year Appendix C for Section 6. I'm thinking about that, and that will continue because this is an important piece that is for all accreditors. We have to have this information. So this is something that once you start with this one, with your IAR, you will be able to continue just adapting it as you move forward. It will always be with you and will be ready then to move forward into your 7-year accreditation report. So program capacity. It's looking more specifically at 3A and 3F. Really thinking about coherent curriculum. And you'll see as I go through this in just a moment about the curriculum. Also looking at the capacity for quality and institutional commitment. Now you see I have in the blue there about 3D and 3E because we haven't addressed those, but we'll get to those eventually, so hang on. This is really looking at documentation of your capacity. How do we know that you have the capacity to really meet the needs and do have the courses and the work for this program and support the candidates and the completers? How do we know that the institution is committed to supporting the program? And sometimes this is documentation. That's where it's a little bit different with standards 1 and 2. When you reach standards 3 and 4, there could potentially be more documentation there. So it's pretty easy for that to start thinking about it in that way. So I'm going to break this down a little bit for you in just a moment also, but capacity indicators for section 6, your curriculum. Okay, really looking at that. Your faculty and the qualifications of the faculty. The facilities, are the facilities up to par and on the same level as what is offered throughout the institution? The fiscal support, is the institution giving you that fiscal support necessary to sustain the work you're doing? Student support services. Do the students have the access to the same support services? You know, the library, the technology, health services. Do they have access to all the information that they need, you know, as a support across the board, as what happens with every other program in the institution? Student feedback also. And this is not only course feedback. All right. This is not just course evaluations. This is program evaluations also. So thinking about that, really looking at what it is for the program, and then collecting that feedback, and what do you do with the feedback? And then how then do you share that information of what you've done with the feedback with the completers and the candidates, or with your stakeholders also? Right. So there's a parity table that's required. And if you've been with accreditation, you know that parity table is pretty much there all the time. It is one of the requirements of accreditation. So looking at this is a sample parity table. Thinking about that. Now the curriculum is going to come in a curriculum matrix, which is why I've got that crossed out. You really don't do a comparison of curriculum across different programs within the institution. But you can do the faculty. You can do a comparison of the facilities, the fiscal support services, and student feedback, as I just mentioned. And again, this is a sample framework, so you can, you know, create your own table, parity table, if you prefer to do so. I've also put in here a table for the curriculum matrix. Again, this is a sample. I put in red font there for you, the ones that really need to be in the table. You can include the state, if a state requires NTAS standards, or if they require any other type of national standards, you can include that. You can include any SPA standards, but they will not be included in making the decision or the review. You have to have the state standards. You have to have AAQEP standards and aspects. All right. So looking at this across the board, this is your curriculum matrix in that alignment. Faculty qualifications table. And this one I did in green font for you. You know, this is one across the board. And this is one that you have to submit for institutional accreditation also. So it's possible that you could have some of this information already prepared. But we have to have the name, you know, the current rank and title. A terminal degree is a good idea, but this is just a yes or no. So, you know, that's questionable, because it should be coming through some other way. The field specialization or certification. And then the big one is the course numbers, a link to the courses. Because what we will do is a random check that the faculty is qualified to teach those particular courses they are teaching, they're assigned to teach. So, you know, that's where we're looking at this across the board. The rest of the information is good information to collect. And so, you know, it's these, but the ones that you see in green font are the ones that we will specifically be requiring. So I said earlier, 3D and 3E, I'm thinking about you want to consider, how are you addressing these in your IAR? I did not drop anything in here specific to address those, but it's something to take into consideration. What is your monitoring process? How are you looking at everything from recruitment to admission, all the way through to monitoring, and then the support in the fields? So thinking about that, how are you doing that, you know? And that ties into your quality assurance and improvement. That's really looking at that auditing also. You know, doing even some type of a random audit, if that's something that you can do, so that you can make certain that what is happening in your program, that you have the equity, you're following through for every single one of your candidates and completers. You're really giving them the support as much as possible. So you think about how that could be addressed in your IAR, and it's a good time then to integrate that into it. Now, section 7, this is the very last section that's in this outline. So this is the evidence of your data quality. Again, this is something that is required. We know that you may have some plans. We also know that you're probably already doing some of this. So what you'll do is just continue the work, build the plans, and really think about then when you go into your 7-year accreditation report that you already have some of this in place. Or you are already putting the plan in place to continue what you're doing. So we'll need that information. So we're looking at the validity, looking at reliability, fairness, and then of course for the qualitative data, we're looking at the trustworthiness. So thinking about those 4 in particular. So this is where you will give your plans and your rationale about how you're going to attend to the data quality. Again, this is thinking about a plan, all right? You may already have those pieces in place, and you could talk about that in your plan, that this is, this was completed at this time, therefore it is now going to be come up for, in 3 years from now or in 2 years from now, we'll readdress it. So thinking about that, how are you going to, really put those results into place for, with a date. I've mentioned a couple of times already that blank copies of the locally developed instruments would be included, that if they are related to standards 1 and 2 in particular, append those, link them in the report. Think about how you're going to affirm the quality of your instruments and document your plans to do so with details. Present in detail any locally developed materials. Now, prioritize your data quality work. I've always laugh about this one because I know that, I had a lot of locally developed instruments when I was at the university. And if I had gone to my faculty and said that we're going to do the validity and reliability, fairness for all these instruments, they probably would have been very upset with me. So this is why we're asking you to do a plan. Think about how are you going to prioritize the ones that need to be addressed first, right up the bat. Where are they? All right. So when was the last time you looked at validity and reliability? Sometimes with proprietary, you have the validity because it's already there, but you may not have reliability for those proprietary instruments. It may be that you've also changed the people using the instruments. So how do you rebuild and restructure the reliability for that? Have the standards changed recently? Does it now call for realignment? Do you have where perhaps there's something that happened that, I'll give the example all the time of the pandemic, and we now know that there's some well-being issues that need to be addressed. How do they get integrated into your instruments? So that, of course, changes the instrument. And so now what do we do in really looking at the validity and reliability of those instruments and the fairness of the instruments also? Do they cut across different aspects and standards? Again, especially for standards 1 and 2, you may have the same measure that is being used in different places in different aspects. It's not the full measure, it's different components of the measure. So how do you really make certain that you've got that validity and reliability for that? Is it so important that it's used as a gatekeeper or even as a benchmark for different stages throughout the program? When you're looking at the monitoring, is there one instrument in particular that you say they have to reach this point? That's your criteria for success. They have to reach this point, all right, in order to move forward to the next section. So, or it could be as a gatekeeper where they don't complete the program until they've completed this successfully. So it's, this is something that you have to tell us. Where are you with that? Where and how do you prioritize that particular part of your data work? So taking in consideration the rationale, your purpose, your timeline, your cycle, and your stakeholders, who's involved in all this work. So here are some questions just to think about when you're looking at this, what processes were or will be followed, to investigate the validity or the data quality of it, who's going to be engaged, not just the program faculty, but also other internal and external stakeholders. And then what have you learned so far? It could be that you already have some of this completed. Maybe you've realized that you might want to change your process just a little bit. What have you learned so far? And then also what could be future results that you want to use. So thinking about that, don't be afraid to jump forward and move forward. Think about some different ways to do this. Just document it and tell us all about it. So again, the initial accreditation report is it's going to provide those measures, all right, that are used to provide evidence of the completer and the program effectiveness. You're going to talk about the partnerships, particularly the P12 partners, and how they're mutually beneficial. really looking at addressing your whole program capacity and integrating those different aspects throughout the components. And then paying attention to the data quality, thinking about that. How are we going to address the data quality? How have we addressed it? Maybe how are we going to move forward with it also? So thinking about that part. So I'm kind of moving into the writing part of this now in a little bit different way. So some helpful navigation strategies. Make certain there's a table of contents. All right. We'll do a checklist for you if you turn it in early enough for us to do that. But the checklist is also on our website that you can look at that. But here's some things. Table of contents makes sense. A glossary of terms. We're across multiple states. I mean, the entire nation has a different way to identify different people even, in different positions. And so we may be coming to your state and have no idea what you call mentor teacher or a cooperating teacher or a supervisor, so make certain that we have that glossary of terms so that we understand, the reviewers understand, exactly, how do you use those terms? And think about the depth of your folder structures. So when you're really looking at building all this information together, how much information are you going to be putting into those folder structures themselves? Acronyms, if there's any question about the acronyms, spell it out. It's amazing how many times we look at what's happening within our state. We do it all the time. Education is famous for acronyms. And so, make certain that you do have an opportunity to spell it out. Fortunately, we're not in medicine because they do their acronyms using Latin. So this is a little bit easier. At least we do use the English language that is more common. Organizational strategies, think of fonts, colors, headers, graphics. Please use graphics, visual relief. Think of your reader, okay? It's very difficult to read some of the reports when there's so much narrative, which is one of the reasons that I've tried to integrate some of those tables in there. But, don't be afraid to really think about how you're presenting other information. Essential information is in the narrative. And then think about it in a pattern: narrative, measures, and the action plan for analysis. So think about it that way. And I think that there's a pretty easy flow to follow. Think of who your readers. Your readers are going to be hopefully a broad scope of people. Your program faculty and leadership, they'll need to look at it. Your review team members, they have to understand it. Your various stakeholders that are going to be a part of, maybe an external group. And then the commissioners really do have to understand what you're presenting. So think about, what are they looking to learn? What do you want to present? How can you help them to understand it? And how can you present the material with clarity? So think of some data visualization if you reach that point in the future also. And one of the things I always try to stress is less is more. This is for writing for busy readers. And all of the reviewers are your colleagues. They're your peers. And I will say, just as you are, they are very busy people. So think of writing for busy readers. There are 6 principles here, and you can capture that information. I'm not going to go through that, all these steps at all, but less is more, thinking about that. So ask yourself, what is your goal? What is your goal for presenting this information? That's the very first part of effective writing. What is it that you want them to know about your program? What are you presenting? And hopefully you're presenting the quality of the program. So make certain that you're clear in your own thinking and that you share your ideas in your story. Everyone is different. That's why I present it in your own context. But keeping in mind, lengthy or disorganized writing is very disrespectful to the reader. So again, go back to less is more. So, and think about that in presenting the information. So I'm going to turn this over. I'm going to go quiet now, and I'm going to ask Sara to start speaking a little bit here for me. So Sara?
I'm here.
All right, fantastic. Just let me know when you need me to move these, okay?
Okay. Thank you, Linda. So I'm just going to go over some very high-level logistics about your upcoming initial accreditation visits. So a few common questions first. When is my IIR due? So that is due 6 months before your site visit, much like our 7-year accreditation. If you do need an extension, go ahead and just email me and ask for one, so I can work on a timeline with you. But our normal due date is 6 months, so that is the deadline I'm going to give you, and then we can work it out if you need a little extra time, especially if you're joining and then going to almost immediately submit your IAR. We also do completeness checks about 9 months before your site visit. And if you're like, oh my gosh, 9 months, that's crazy, there's no way I could actually get my IAR in that early. Don't worry. I do highly recommend going ahead and just downloading our completeness check right off of our webpage. I think Linda actually mentioned this earlier, and you can use it internally. Because the completeness check is really just a check that is intended to ensure your self-study is complete and ready for official submission. So we're not going to give you a lot of feedback or evaluation or anything like that. That's not our job as AAQEP. Instead, we're just going to make sure that you have all of the sections that you need and all of the components there. So it's really useful also as an internal review. So like I mentioned, it's on our website. I highly recommend you download it. You can send your IAR as a PDF to me, the Sara Hiller, Director of Accreditation Services. If you are linking out to a virtual platform that houses your evidence, for example, like Dropbox or Google folder, just go ahead and make sure that I have access to that, as well as Christine DeGregory. All of this information is in instructions I'm going to send you after we secure your site visit date. So don't worry too much. I do send all of this information in an email to you. And then how many IARs do I write? Great question. It does depend. I will say I've only had people submit one IAR so far, but you could submit more than one if you would like to. And if you do only submit one IAR and then you decide to actually submit more than one QAR, that is totally fine. You are not locked in if you decide to submit one IAR. So I think that's the next slide, Linda. Okay, perfect. So how many IARs? So keep your audience and your program design in mind. If you're going to do it all in one, maybe you have a coherent evidence set, and the evidence must be aligned to the aspects of Standard 1 and Standard 2 for all programs. If you're going to do more than one, you probably have different evidence sets, varied governance, and maybe autonomy of programs. Anything else here, Linda? No, all good? Okay. Like I mentioned, though, most people only submit one IAR, so I haven't actually seen anyone submit two. But again, this is definitely something to keep in mind if you do want to submit more than one. All right, so I think next is, yes, the accreditation decision. So you have your site visit, and then 3 to 4 months after your site visit is your accreditation decision meeting. This is also virtual over Zoom. Your team lead is invited to the meeting, and your decision is effective immediately. So you will sit in full transparency, see all the commissioners there, and they will make the decision during the meeting, and you will leave the meeting knowing what your decision is. All of our current policies for decisions are the same as 7-year, other than the fact that it's a 5-year non-renewable for initial accreditation. So you could get the same types of notations and all of the different like affirmative and all of that for the decisions. We do have a decision webpage on our website that is really useful to look at if you want a quick snapshot. We also have the decision section of our guide to accreditation that you could take a look at if you would like to. Then you will follow the timeline for 7-year QAR decision. So that would be within 3 to 5 years, depending on your state policy, right? So, but don't worry, I will let you know when your next site visit is. I just line them all up on my site visit decision tracker. So we will let you know, especially if your state has a different timeline than our normal 5 years. And then I believe next is our timeline, Linda. Yes. So just a quick little review of our review timeline. So you have about 1 year before your site visit, you're going to secure your site visit dates with me. I will send an email to you with a form to let you know about that. Then 6 months before your site visit, you're going to turn in your self-study and nominate your local practitioner. Then 4 to 6 months before your site visit, you're going to attend a logistics call with me. And this is where I do a deep dive into everything about your review, all of the different steps that you have to complete. So this is a really important call to attend. And then you have your provider meeting 1 month before your site visit. This is a big meeting between you and your team where you go over your pre-visit review report. You get to meet the team for the first time and really do this big check-in with them before your visit. Then you have your virtual visit. And then, like I mentioned before, your accreditation decision meeting is usually 3 to 4 months after your site visit. So that is our whole review timeline. Thank you. All right, so just some very high level virtual site visit logistics here because I have also a very long PowerPoint with logistics for my logistics call. So again, I'm just going to repeat that your local practitioner nomination is also due 6 months before your site visit. The earlier you can get that into me, the better. I know our local practitioners are really one of the harder parts of our process, but it's really important to get that information to me right away. We do have guidelines for selecting your local practitioner located on our webpage, so please take a look at that guidance. And this is something I will go over during the logistics call as well. Your logistics call is 4 to 6 months before your visit, and your virtual visit is 2 days. They are 2 full days, even though they are virtual, and we do have schedule guidance and a sample on our webpage. So again, looking at that initial accreditation pathway webpage, all of my logistics call documents are there. So if you're ready to dive in and start to look ahead at your review, that's your one-stop shop for everything that you need. All right. Oh, yes. And then our review team members. So our review team members are only there to affirm and verify evidence only. They do not make any recommendations or judgments. That is the job of the Accreditation Commission. So they will use your IAR to document evidence, follow up on that using clarification questions, and also have stakeholder interviews during your site visit. And they will affirm and verify and gather evidence, like I mentioned. And the report serves as supplemental information for the commissioners. So the commissioners will look at your IAR and at the quality review team report together as your documents for evidence as they move forward to make their decision. And again, your review team does not make any judgments. They are there to affirm and verify evidence only. And then speaking of reviewers, yes, the best way to get involved is to become a reviewer, especially if you're in the middle of or starting to write either an IAR or QAR, whatever your self-study is. Really, you can get some really good experience if you join as a reviewer. That's like, honestly, I say the best training is just to join a review team and really because you get to see somebody else's self-study and work with other people to look for the evidence and do all of that. So honestly, it is one of the best ways to get ready for your own site visit is just to sign up to be a reviewer. Anything else, Linda?
No, I think that's it. Here we are. We're on social media. Sara and I are on social media a lot. Just so that you know, if you need to contact us, there's my email address, and Sara's also. So if you'd like to contact us, Sara is all about the site visit information. I just need you to know that. Pretty much anything else, either Karen or I can help you with. The website there is aaqep.org/IAP. We thank you very much for joining us today. And I'm going to close out the recording now. So please stay with us. I will close in just a second.